Ah, the toothache. It's not just a pain, is it? It's a full-on alarm bell from your body screaming that something is wrong. But when that throbbing, intense pain actually hits, what do? Well, we're going to dive in and map out that entire journey, from the first jolt of pain all the way to making sure you never feel it again.
So there it is, that pain. It's real, and you can't ignore it. Your first instinct might be to panic, right? But your first action should be super calm and specific. And you know what? The answer is probably a lot simpler than you think, and it might just give you relief, like right away. Let's start with what you can do right this second, with stuff you probably already have in your kitchen. This is all about those safe first steps to get that awful pain under control.
Okay, before you even think about reaching for a painkiller, the very first thing you should do is just clean the area. I mean it. Rinse your mouth really well with some warm water. The goal here is to knock loose any little bits of food. Then, and be gentle here, floss on both sides of that sore tooth. You'd be amazed how often the real culprit is just a tiny piece of popcorn or something stuck in there, creating all that pressure. Get it out, and sometimes the pain just stops.
Now, what about that classic saltwater rinse? It's not just some old wives' tale. There's some really cool science behind why it works. When you mix salt into warm water, you're basically creating a special solution. And through a process called osmosis, that salty water literally pulls excess fluid out of your swollen, inflamed gums. And think about it. Less fluid means less swelling, which means less pressure, and best of all, less pain. It's simple chemistry doing its thing right in your mouth.
All right, so what if you're still feeling that ache and you've got some swelling? Your next best friend is in the freezer. Cold is a classic for a reason. It launches a two-pronged attack on your discomfort. And here's how that attack works. First, vasoconstriction. That's just a fancy word for saying the cold makes the blood vessels in that area shrink. Smaller vessels mean less blood flow, which dramatically reduces swelling. And second, nerve inhibition. The cold literally slows down the speed of the pain signals traveling to your brain. It's like creating a traffic jam for the pain. Just remember, wrap that cold pack in a towel and only put it on your cheek for about 15 to 20 minutes at a time. Okay, we've exhausted the kitchen remedies. Now let's move on to the pharmacy for some more powerful options that you can get without a prescription.
Now this is super important, because not all painkillers are created equal. Ibuprofen works right at the source of the injury to fight inflammation. That's the thing causing that deep, throbbing ache. Acetaminophen, on the other hand, works up in your brain. It doesn't really reduce the swelling, it just tells your brain to ignore the pain signals. So if your pain is throbbing and swollen, ibuprofen is going to be your more targeted weapon.
And get this, because this might blow your mind. For really bad dental pain, like after getting a tooth pulled, clinical studies have shown that a combination of regular over-the-counter ibuprofen and acetaminophen taken together is actually more effective than many prescription opioids. No kidding. By attacking the pain from two different angles, at the source and in the brain, you get better relief without all the risks.
Okay, time for a huge safety warning. I need you to listen closely. You might have heard this myth about putting an aspirin tablet right on your sore tooth. Do not, I repeat, do not do this. Aspirin is an acid. It will do nothing for your toothache, but it will give you a nasty chemical burn on your gums. You'll just be adding a whole new problem. Painkillers are made to be swallowed, period.
So far, we've just been treating the symptom, the pain. But to really fix this, we've got to play detective. We need to figure out the cause. Your pain is trying to tell you a story.
Yeah, think of it as a pain narrative, the specific way your pain feels. Like, is it sharp? Is it dull? Does it only hurt with cold things? All of those details are vital clues about what's really happening deep inside your tooth.
So let's trace the story. It often starts small, right? A little sensitivity to ice cream or candy. That's a sign of early decay. If you ignore it, it can grow into a sharp pain whenever you bite down. That means deeper decay or maybe a crack. Next chapter? A constant, throbbing ache that doesn't go away. That's a bad sign the infection has reached the nerve. And the final, most dangerous stage? The pain is now joined by a fever and a swollen face. That means the infection has escaped the tooth and is now in your body. And that brings us to the most critical decision you'll have to make. Once you understand the story your pain is telling, you can make the right call. Is this a job for your dentist, or is this a trip to the emergency room?
This is a question you really don't want to get wrong. You have to understand, the hospital ER is set up for life-threatening emergencies, not for doing dental work. Sure, they can give you antibiotics and painkillers to manage the crisis, but only a dentist can actually fix the tooth.
So the key is knowing when that dental problem has become a full-blown medical crisis.
This chart makes it pretty clear. Pain that lasts more than a couple of days or a lost filling, that's urgent. You need to call your dentist. Severe, throbbing pain with some swelling on your gums, that's a dental emergency. Call an emergency dentist. But, and listen up, if you have a high fever along with that swelling, or if the swelling is making it hard to breathe or swallow, that's a medical emergency. You go to the ER immediately.
Let's just hammer these red flags home because they're that important. Swelling that messes with your breathing or swallowing could literally block your airway. That is a top-tier emergency. Swelling that's spreading up towards your eye or down into your neck means the infection is spreading fast. And a high fever means your body's losing the fight. Any of these signs mean you get to the hospital, no questions asked.
Okay, we have navigated the crisis. Now, how do we make absolutely sure we never, ever have to go through that again? Because truly, the best cure for a toothache is making sure it never starts in the first place. And the good news is it all comes down to a pretty simple 5-part playbook. These are the pillars that are going to support your oral health for life. Good old-fashioned brushing and flossing, a smart diet, using fluoride, and, you guessed it, regular checkups with your dentist. And here's the game plan. Brush twice a day for 2 full minutes with a fluoride toothpaste. Floss every single day. It cleans the 1/3 of your tooth that your brush just can't reach. Try to keep sugary stuff to mealtimes, which limits the number of acid attacks on your teeth throughout the day. Drink water with fluoride. And see your dentist regularly. They can spot a tiny problem long before you'd ever feel it, which can be the difference between a simple filling and a root canal. So, let's end on this thought. A toothache isn't just about a tooth. More and more research is linking ongoing problems in your mouth to serious conditions like heart disease and diabetes. Your mouth really is a window into your overall health. So by taking care of it, you're not just saving a tooth, you're investing in your entire body. So let me ask you, what is your health telling you today?